Welcome to another episode of Cowdemy.com. Today's episode is all about one of the most essential parts of a cow's body, her hoof. More specifically, we're talking about hoof anatomy. We'll walk through the external and internal structures of the bovine hoof, highlight what each part does, and explain why this knowledge matters. The truth is, hoof health plays a foundational role in a cow's life. It influences how she walks, how she lies down, how much she eats, and how much milk she produces. When hoof problems show up, things can spiral fast. That's why understanding the anatomy is so important. Let's start with what we can see and feel, the external structures of the hoof. Cattle are cloven-hoofed animals, which means each foot is split into two separate digits, or claws. These are called the lateral claw on the outside and the medial claw on the inside. They're mirror images of each other and correspond roughly to the third and fourth fingers on a human hand. The space between them is called the interdigital cleft, and the soft skin inside that gap is known as the interdigital skin, a vulnerable area that can become inflamed or infected if it's constantly wet or dirty. Now let's focus on the hoof wall, the tough outer shell of each claw. It's made of keratin, and its job is to support weight and protect the internal structures. But the hoof wall isn't just one smooth curve. It actually has distinct regions with different roles. At the very front of the claw is the dorsal wall, commonly referred to as the toe region. Then along the sides, we have two important terms, the abaxial wall and the axial wall. The abaxial wall is the outer surface of the claw, the side facing away from the cleft toward the outside of the foot. This side is typically more visible and easier to examine during trimming. On the other hand, the axial wall is the inner surface, the side that faces the other claw and lines the interdigital space. While it may be harder to access, it's just as important. Damage or imbalance between the axial and abaxial walls can lead to uneven weight distribution and hoof stress. All of this wall horn is generated by a highly active structure at the top of the hoof called the coronary band. This is a vascular living tissue that continuously produces new horn material. As the horn grows downward, it forms the outer hoof wall over time. This growth is what allows the hoof to renew itself, but only if conditions are right. Underneath the wall lies the sole, which forms the underside of the claw. It's slightly softer than the wall, but still made of keratin. Its main job is to cushion and protect the underlying corium. While it doesn't carry as much direct weight as the wall, it plays a big role in absorbing impact and distributing pressure. Connecting the sole and the hoof wall is the white line, a narrow, light-colored strip that's softer and more elastic than the surrounding horn. That elasticity is great for flexibility, but it's also a weak spot. Damage or separation here allows bacteria to enter, often leading to white line disease, one of the most common and frustrating causes of lameness. Then we have the heel bulbs, which are soft, spongy areas at the back of each claw. These provide extra shock absorption, especially when the cow walks on hard or uneven ground. They're critical for movement comfort and are often affected by heel erosion in wet or slurry-covered environments. From here, let's move inside the hoof and talk about what you don't see but definitely need to understand. One of the most important internal structures is the corium, the living tissue underneath the wall and sole. It's packed with blood vessels and nerves, and it's responsible for producing new horn. It's also highly sensitive. Inflammation of the corium, especially in conditions like laminitis, causes significant pain and can trigger serious structural changes in the hoof. Right below the corium lies the digital cushion. This is a pad made up of fat and fibrous tissue positioned between the pedal bone and the sole. Its job is to absorb impact forces and help distribute weight. When a cow is in good condition, especially a younger or well-fed one, this cushion is thick and protective. But if the cow loses body condition or as she ages, the cushion can shrink and become less effective. That's when you start seeing pressure lesions like sole ulcers. The pedal bone, or P3, is the largest bone inside the hoof. It gives the claw its shape and provides structural support. But here's what makes it fascinating. It's not just sitting there. It's suspended inside the hoof capsule by a network of collagen fibers called the suspensory apparatus. These fibers anchor the bone and keep it elevated. But when they fail, due to chronic stress, inflammation, or poor body condition, the bone can sink or rotate, which leads to internal damage and often severe lameness. Attached to the back of the pedal bone is the deep digital flexor tendon, which plays a critical role in hoof flexion. It works in tandem with the navicular bone and a small fluid-filled sac called the bursa, which helps reduce friction and pressure within the joint as the cow walks. As you can see, the hoof is far more complex than it looks from the outside. It's not just a hard casing, it's a living, responsive structure that needs to grow, absorb impact, and carry the weight of a full-grown cow, day in and day out. And when one part of that system fails, it can affect the whole animal's comfort and performance. That's why understanding the anatomy is step one in preventing problems and managing hoof health effectively. If you found this episode helpful, there's so much more where this came from. At Cowdemy.com, we're committed to bringing you accurate, practical, and up-to-date education on hoof care, barn management, nutrition, disease prevention, and more.